Caitlin. I am a student at Advent Health University in the Doctor of Physical Therapy program, and today I'm going to be discussing the importance of body mechanics with you all. So, body mechanics are essential to maintain in the physical therapy profession because it allows patient care functions to be performed more efficiently and with less risk of injury for the patient or the clinician. Now I'm going to be discussing some proper body mechanics with you. The first and most important part in this process is to assess the situation and to plan ahead. This is going to include clearing your pathway of any obstacles and bringing any supplies that you may need close by. The next is to stand close to your load. Once you are standing close to your load, you'll want to position your body in the proper stance. This means to have a wide base of support, meaning that your feet will be approximately shoulder width apart. You'll want to make sure that throughout this process that you are using good posture. This is going to mean that you're maintaining a neutral normal spine curvature. Next, you'll want to position yourself to be able to flex at the knees and the hips. This is going to put you into a slight squat position. You'll want to make sure that you don't bend at the waist. Now you will begin to prepare to lift the load. You'll want to tighten your abdominal muscles so that it helps you to engage your legs and to not use your back throughout this process. Once you have the load, you'll want to hold it close to you. It is very important to be able to remember to breathe throughout this process, inhaling as we lower the load and exhaling as we're lifting the load. We also want to make sure that we're avoiding twisting at the trunk. So throughout your process, you'll want to pivot or take small steps in the direction that you're wanting to go. Once you have reached the destination where the load will be set down, you'll want to set it down carefully. This is going to include setting it down, flexing your hips and knees to avoid using your back. If you are moving an object and not a person, the weight of the object can be tested using your foot prior to attempting to lift it. This will help you to determine the amount of exertion that will be needed to lift the load. Now I will show you how all of these steps come together in order to perform a manual lift with the patient. Scoot forward towards me so that I can be close to you as we transfer. And I'm going to have you lean forward towards me so I'm able to get underneath and assist you if needed. So my legs are staggered and I'm close to the load. And now we're going to be standing, my spine is neutral, and I'm engaging my trunk in order to help me use my legs to lift. On my count of 3, we're going to stand and step and transfer into the wheelchair. Are you ready?
Yep.
Okay. 1, 2, 3. Okay, and step. Okay, reach behind you for the armrests and slowly lower yourself. So you want to make sure that whenever you have the opportunity and you're able to push a load, that you should be pushing instead of pulling it. So pushing with good proper body mechanics instead of pulling on the load. It's important to recognize when you'll need assistance with a heavy load, so you can always ask for it. Talia here is going to help me today. On my count of 3, we'll move towards you. 1, 2, 3. Just to reiterate the contraindications of proper body mechanics, you'll want to avoid using your back throughout any lifting. Also avoid twisting at the trunk and make sure you are setting patients and objects down properly. It's also important to remember to push the load instead of pulling it whenever possible to avoid injury. Thank you all for your time. I hope you found this video informative and helpful.